So who am I? Well, I am called Shailaja, and it's been 25 years in this laboratory operations, and and I love teaching. I love teaching. And our goal today is to understand how to maintain sample integrity, which is vital in producing accurate lab results, and how it impacts patients' outcome. I hope all of you all have understood the key essence that I wanted to convey today is patient preparation, patient timing, sample integrity. And that is what we will be covering, and all the errors that can happen, and the best practice to avoid errors, and the strategies for implementing these practices in your lab. So let's get started. Why it matters? Because anything that is not done, it will alter. It will alter right from the time we collect the sample. And that affects the diagnostic accuracy and can lead to false or misleading results and misleading diagnosis. I'll just move this up, please. Yeah. Misleading diagnosis or inappropriate treatment. Now, imagine many people say hemolyzed sample. How many of you all have ever thought hemolyzed sample, CBC sample in a purple color tube, not knowing it's hemolyzed because we are not centrifuging it? How many of you all think that the hemoglobin content of it will be normal? When you run it through a 5-part or a 3-part or a 8-part, they calculate the cell size. Depending on the size of the cell, the machine will detect, okay, it is RBC, it is WBC, it is platelets. Now, if the cells are lysed and the number of cells are lysed, isn't that the RBC count is going to come down? Anybody have you all ever thought about it? That is the crucial part. In biochemistry, we think about hemolysis because we centrifuge it and we can see the lysis. But what happens in hematology? We don't get to see it. And those are the hidden things that will lead to wrong errors. Now, critical steps: patient preparation, sample collection, handling, labeling, transportation. At every level, only if we are correct, then everything will be correct. Otherwise, we are vulnerable to errors. And like I said, 65% of the errors occur at here. And because of the errors, misdiagnosis harmful. So, improper patient preparation, incorrect collection techniques, transport issues, everything is a matter of concern. We have to address it. Now, types of errors. As I told you, what we don't see and what we see. Red blood cells, hemolysis, clot, microclots. The WBC is gone inside, the RBC is gone inside, the platelets are inside the microclot. Then what will you get the values? 100% it will be wrong. And that is when you have to look into the histogram in the system. So just one small mistake. You have a sample, they have not mixed it properly immediately. Microclot formation. If they've not mixed, means big clot, that you can make out. But what you can't make out is this small. That also by the histogram we can make out. Now, mislabeling, misidentification of samples. Somebody else's value, somebody else's report to somebody else. Imagine we suddenly get a report that our creatinine is very, very high. Our urea is very, very high. And when do we realize that creatinine becomes high? When half our kidneys are already gone. What a shock it will be. All we know that our sample was labeled, somebody else's sample was labeled with our name. So first and foremost, what we do not, when the patient comes with the bill, We generate the label, stick it onto the vacutainer, and give that to the patient. And he goes there and they collect. We don't give the labels to the phlebotomist to stick on the tubes. At the registration counter, we stick the labels on the tube and give the tube to the patient. So that patient has his own tubes with his own value. Got it? These are steps to mitigate errors. Patient identification. Manjunath, Srinivas, David, 101 people, similar names in India also. So don't go by the name, go by name, go by hospital number. Always look whose bill is it? What is the name on the bill? Then collect the sample. Incorrect labeling, as I mentioned, contamination, as I mentioned, sample degradation. You take a sample after 45 minutes, 1 hour, 2 hours, 3 hours, you send it to the lab. Gone, glucose value is gone. It will deteriorate. More than 4 hours, CBC will deteriorate, all the cells will deteriorate. These are very, very common, and we think that no, the person who's doing it is doing it properly. Until the clinician calls and something is wrong, they are not correlating. No. How do we stop it? We need to do random checks. But before we do random checks, we need to train our people properly. We have to train them in what are the containers, what right containers. The integrity of that sample depends on the container. And if it's a blood to anticoagulant, that is so important. What are the additives? I've seen people EDTA tube they collect. Suddenly they forgot that they had to collect in a red color tube or yellow color tube. Take the EDTA sample, put it in the yellow and then our potassium comes very high. Where did the potassium come from? It came from the EDTA tube. So we need to understand that for certain tests, there is a certain vehicle to collect. Those are called containers or vacutainers. For sterile sample, we have sterile bottles. For unsterile, we have unsterile ones. We have swabs. We have blood culture bottles. And we need to use the right sample container also. We need to label it properly. We need to store it properly. We need to transport it properly. We have to, the chain of custody from one place to another place, when we have to give, we have to ensure that we are able to trace. Where did it start? Who came and gave it? When did they receive it in the lab? When was the sample processed? When was the result given? Sample was collected 7 o'clock in the morning. It came in the evening 4 o'clock. We have run it at 10 o'clock, reported at 12 o'clock. Only when we document, we will come to know, oh my God, it happened like that. And then when we come to know, we'll know we have to ensure we put a system into place in the chain of custody. So there's so many angles to sample collection. Sample integrity. Collection is one part. You have containers, you have labeling, you have transport, chain of custody. And if all this is not okay, you have consequences of misdiagnosis. 100% wrong report, 100% it is wrong. Plus, the patient, instead of getting better in 2 days, it will take a longer time because he's not getting treated for the value which is inside his body. And then we have to repeat the test. Again, he has to pay for it. Legal liability is now coming in. But most important, if a patient comes to our hospital and he doesn't get the right treatment, he's not going to come back again. So it's very, very important. Forget about that. If we can't help, at least let us not do harm. Let us all learn to put systems into place and ensure we help the patient rather than harm the patient. So what is the role of we healthcare providers? Remember, all the phlebotomists, all the nurses, all the physicians, I'm reiterating here, and the laboratory staff. We are a team. And unless all of us know what is our role, what is our task, what is our responsibility, there is no way that we will do our job properly. So each one of them should have a role, task, responsibility document. What I should do, when I should do, how I should do. When that document comes to me, I know, okay, I'm supposed to do this. I'm supposed to do it like this, like this, like this. I'm supposed to do it at this point of time. When you give somebody that, don't you think it will be very easy for them to follow? So remember, for high quality samples, the phlebotomists need to be told. We are assuming the moment they have a degree, we are all assuming that they know their job. We are assuming that they know what to do. We are assuming that they know everything. No, we need to train. We need to teach. We need to learn how to train also. See, knowing something is one thing. Teaching people in a way that they understand is a totally different thing. A good teacher makes complicated things easy, and a bad teacher makes simple things complicated. How many of y'all resonate with this idea? If he's a very good teacher, in our student days, maths teacher, oh, so good, they really, we could understand. And there were some teachers who, how much ever they told us, it just didn't get into our brain. So knowing is something, able to communicate and let the other person know what you know so that they understand, they do it, and they are able to teach somebody again who will do it correctly. Then you say that you know the subject. By hearing about it, we cannot say we know it. When we know, we implement, then we teach somebody and they implement and they teach somebody and that other person also implements correctly, then the cycle gets completed. So remember, do not assume that people know. Start learning, start teaching, start training, watch what you taught, whether they are able to do it exactly the way you wanted it to be done, not how they perceived it has to be done. Then once they master it, ask them to teach their juniors. And once they are able to teach and they are able to get a good job done, then your role is to step back. You have a robust system in place. Then that cycle will continue. Others, every time you have to do the teaching. Okay, nurses and physicians, we have to tell them, I will not accept a sample. Only at 8 o'clock, only at 4 o'clock cortisol. I want fasting, it's 12 hours. And if suppose we see that patients are not fasted, we take in an undertaking that it is emergency. Otherwise, we tell the patients, please come back. The values are not going to be right. And all the lab staff they need to verify sample integrity. Processing the specimens, reporting are based on the quality of the original sample. When I mean original, it means the moment the sample was taken in the patient's body to when you are actually putting it into the machines or you're doing the testing, till that time, the entire sample is exactly how we took it from the patient. How many of you all feel that the samples that we are collecting today, when we are analyzing, is 100% the same when we start analyzing? I want you all to start putting in the chat box. I want to see how many of you all feel 100% it is correct, and how many of you all feel no, it is not correct. If you feel no, type in N. If you feel yes, then type in yes. Why? All of you all start, please. I want you all to start. Absolutely, there's no harm in saying that. We all were in the same boat. Exactly. There is nothing wrong in accepting that we need to put systems into place. Only when we accept that we need to put systems into place can we help patients. If we are in the thing is, no, everything is okay, we are under false, we are harming patients. So today, let us understand that these were not taught to us. We need to now concentrate on this area. We need to learn how to put systems in this area. And we need to make all this ends into whys. Absolutely. The first step is we acknowledging, yes, there is a gap. And once we acknowledge, then we should learn how to plug that gap. And to learn how to plug the gap, we should learn how to do it correctly and then train our staff to do it correctly. Thank you all of you all who have said, no, we know that that is the truth. So let's start acknowledging the fact that there are no systems, and not only in India, all of the world. That's why only 40% of the labs around the world are accredited. It is not only unique to India, because this is not taught in our curriculum. They teach us as medicine, as palpation, percussion, everything. But where did they teach us about all this? With equipment coming in, vacuumers coming in, all the sample collection, we were not taught all these things. So there's no harm in saying, no, okay, now we acknowledge it. Let's start working towards it.